Welcome to the Doctors Roundtable with your host, Alan Gurvy. Alan is joined by a panel of experts to discuss hot topics in health and medicine with a focus on an integrative approach that encompasses physical, emotional, and spiritual wellness to help you live life at its fullest. Are you moving through the challenge of disease and struggling to find your way back to good health? Do you want to hear about alternative approaches to standard treatment? You need support. The Doctors Roundtable has you in mind and wants to provide information, options, and hope as we try and make the best decisions to prevent disease, age successfully, and live a full and healthy life. Now, here's your host, Alan Gurvy.
Good afternoon and welcome to the Doctors Roundtable with Alan Gurvy. Thanks for joining us today. This is the show where we speak to some of the top-notch physicians in Southern California, and we get an idea of some of the medical conditions, treatment, diagnoses that you want to know about. And today is no exception. I am Alan Gurvy. I am your host. And of course, I am the managing partner of the law firm of Rowe & Gurvy. I've known for Gurvy's Law. And today we are talking Doctors Roundtable right here on Talk Radio 790 KABC. And we are going to get right into things because we have two of the top physicians, psychologists, and an ENT doctor, that's ear, nose, and throat. We have Dr. Farhad Sigari with us, who's one of the leading experts, sinus doctors in Los Angeles, and all other conditions related to ear, nose, and throat. He's been awarded the Patient's Choice Award several times as one of the top sinus and allergy doctors in the country. And I'll tell you, I have had problems with allergies, so I really want to talk to Dr. Sigari. And joining Dr. Sigari is Dr. Liana Georgoulis, who's one of our favorites here at the Doctors Roundtable. She knows everything about everything. She is with the Coast Psychological Services. Of course, she's the founder of Coast Psychological Services. She works with older adolescents, adults, and couples, improving relationships. She works on depression, self-esteem, and what she really has a knack for is dealing with people who have medical conditions. Physical medical conditions or perhaps somatoform, psychosomatic, whatever it is. It's very important that psychology comes into play when we talk about complicated medical conditions. And we're going to start right now with a complicated medical condition because I can tell you, Dr. Sigari, there are so many people out there listening today on Talk Radio 790 KBC who have problems with their sinuses and they don't know what to do. So the first question I have to ask is, what do people do to diagnose? Should they self-diagnose their problems when they can't breathe properly, when they're getting sinus headaches? What do you do, Dr. Sigari?
Well, Alan, thank you for having me on the show. It's
no problem.
Great to be here. I think you asked a very good question. A lot of times people either don't know what to do or are not aware that they are even having a problem.
Right.
So the first thing they can do is when they're having the issue is actually try to diagnose what they're feeling. What is it that I'm feeling? Is it that I can't breathe that's really bothering me? Or is it the post-nasal drip? Or is it the fatigue that comes with it? Or is it really just a significant headache? And depending on what the headache is, it definitely can be related to the sinus. So, and most people, as they should do, is actually try the over-the-counter medications because especially now, some of the medications that were previously prescription medications are now available over-the-counter, such as the nasal steroid sprays.
And let me ask you about that. And I hate to interrupt, but we'll talk more about it.
Sure.
But tell us about some of these prescription drugs that are now over the counter and how that process works. Because a lot of times I look at medications and I think, okay, I need a prescription. Then the next day I see, oh, it's over the counter. Are they the same drugs? Are they as potent? I mean, should I be fearing them because they used to be prescription? How does that work?
No, that's a great question. And actually, it's very nice that some of these medications are over the counter now because before, just to get the medication, the patient had to go see the physician, get a clearance, make the time to go see them, where now they can just pick up these medications over the counter. And these medications that are now over the counter were previously deemed to be safe enough, have been in the track record of being prescribed, monitored, they've been used for years, and they've also have done some commercial issues where they've ran out of their patents and
that's true.
Deemed safe to be in the over-the-counter hands. And and now available for anybody who can reach out and get one. Before, there wasn't very much that the patients could do over the counter.
Yeah.
And over time, as each one of them came and became available over the counter, it's a better, it's actually better for the patients.
Now, in the past, people would take perhaps Tylenol or
Right.
aspirin. They had headaches. They didn't know what to do. They'd take some cold remedies.
Right.
Now, how can they determine whether it's something that they should take over the counter because it's a common cold or it's some congestion or it's something that is really a little more complicated and they need to see you or one of the experts in
Right.
Allergies or any of that sort of these disorders?
Great. Yeah. Well, first of all, if anybody's having severe discomfort or if it's having fevers that are out of control or pain that's out of control or they're just significantly fatigued, they should definitely see their physician and maybe get the referral to a specialist. But if people who are having symptoms that are bothersome but are not acute and are just generally annoying, they can definitely consider trying something that's over the counter and trying those regimens. I actually recommend to my patients to try things that are not even medicine, something as simple as a Neti Pot or a saline rinse to the nose can be quite effective.
Tell us what a Neti Pot is.
So the Neti Pot is a term for a basically nasal lavage. So there are over-the-counter kits that you can buy that you can mix distilled water with prepackaged salt and sodium bicarbonate. So you can make saline in this bottle and then squeeze into your nasal passage. And believe it or not, it makes a huge difference for a lot of patients. It helps remove a lot of the irritants that might be causing inflammation. It'll help remove mucus. And a lot of times, there's been some studies that show that sometimes in the beginning of a cold, the antibiotics work just as well as an Neti Pot because the antibiotic is not necessary, and you just need to relieve the area of the irritants that are there and start out with something as simple as a saline lavage.
So you mentioned antibiotics, and we're going to get to Dr. Leon in a second, but this is something really important that we talk about a lot on the Doctors Roundtable, and that is, are they being overprescribed? You're in a situation where I'm sure all of your friends are always calling you, hey, prescribe some antibiotics. I need to get rid of these flu symptoms, this cold, these sinus infection, allergies. What do you do?
No, that's another good question. I think that's one of the problems that physicians deal with is how to appease the patient to give them something that's is going to work well enough for them to be happy. At the same time, not give them antibiotics when they don't need it. So one of the key pieces of information that came out in all the studies that they've done and actually recommended in the practice guidelines for sinus infections is the length of time of symptoms. So unless they have severe pain or severe fevers, which they should definitely be seen and get antibiotics, if their symptoms are anything less than 7 to 10 days, they should wait.
Really? 7 to 10 days?
If it's less than 7 to 10 days, they should wait.
Oh, man.
And try the over-the-counter medications first because likely it's a virus.
But people don't do it. They don't have the patience. And I want to ask Dr. Leanna now, because you deal with a lot of people who have emotional issues. They have reactivity. They react to physical problems poorly. They may be what we call in the legal profession thin skull, eggshell people. How do you deal with these people? Because what Dr. Sigari is talking about is, wait 7 to 10 days, relax, let the process go through itself, and then if you still have a problem, then you need to call Dr. Sigari. People don't think that way.
Right, and it can be challenging. I myself have struggled with allergies in my life, and for years and years, I had all these different types of medications and asthma and different things. And actually, finally, it wasn't until maybe 4 or 5 years ago where a doctor finally recommended I do allergy shots, and they started injecting me with things that I was actually allergic to. And it made such a huge difference. So I go back to when you feel strong and solid in your body, you feel emotionally and mentally strong. There's such a strong relationship there. So I think whenever we're in physical discomfort, it's about how do we cope with that. And there's different ways of teaching people how to cope with physical discomfort. And it's about learning how to do that and learning how to kind of retrain the brain to accept, to relax, to be aware, to be mindful. And some people are better at that than others, but a lot of my work is about teaching those things to people.
I think that's
Go
a great
ahead.
point
Yeah.
because as physicians also we should recognize that and know that the patients in your office, they took time to come see you because they're looking for help. So if
Right.
you just tell them, look, you don't have a sinus infection, deal with it and call me if it's worse, they really are not going to be happy. But I think the key thing in that situation is actually give them some other alternative. Like what I often tell patients is, listen, I can give you the antibiotic and I'll give you the prescription, but do me a favor and don't take it. Wait a couple of days. Try these other things that are over the counter first. And if you're still having problems, which will get them closer to that 7 to 10 days, then you can take it. And then the patients then get a sense of relief that, oh, he's not going to leave me in the dust. It's going to be a weekend. I'm trying to get the antibiotics later, or I'm going to get a flight. What do I do for the flight? Or I have a big party coming up. What do I do for that? They want to feel better. So if you give them a clear action plan of what to do, they're often actually very appeased and can address some of the symptoms you're talking about.
And that's a great point. Dr. Liana, when we talk about perhaps what we might call a security blanket or something, why do people really need that? Because what Dr. Sigari is talking about is, hey, you know what? It probably will get better, but if it doesn't, here's some antibiotics. And people want that. They want that option. They just don't want to be looking in the mirror and thinking that there's nothing for me here. I'm doomed.
Yeah. That's how the brain works, right? Our minds were developed to be able to prepare and plan and predict and problem solve. And I think that the more structure and the more sense that there's a solution to this problem, the more at ease people feel. But that can be a trap as well, because there's not always clear-cut solutions to things. And when there's not, people tend to get really nervous and anxious. So how do you deal with uncertainty, and how do you deal with not knowing and not knowing what the solution is and where this is heading to? And it's about learning how to work with your thoughts and your thinking patterns to be able to get to a place where you feel more settled without those kind of security blankets or kind of safety. We call them safety behaviors. I might be talking about that a little bit later in the show.
I really appreciate you saying that, because it's really important in all kinds of physical conditions. There's always a mental role in getting better. We're talking with Dr. Farhad Sigari and Dr. Liana Georgoulis. They are talking about sinus, allergy infections, some of the unknown causes of headaches, and we're going to get into the psychological aspects as well as they play together. There's an interplay that is very, very important. Stay tuned. You're listening to the Doctors Roundtable right here on Talk Radio 790 KBC.
Coming up on the next drive home with Jillian Barber and John Phillips, Moments of Brilliance.
Peppered with completely inappropriate rape jokes.
Live and local, right after Psycho Mike and Dr. Drew on Talk Radio 790 KABC.
Hi, welcome to Staples.
Hey, Staples guy, my store just opened down the street.
And you need to get the word out.
Right.
Well, Staples is your one-stop shop for all printing and marketing needs.
So you can print grand opening flyers?
Yes.
Grand opening banners?
No problem.
Custom t-shirts?
Piece of cake.
You sell cake?
It's just a saying.
Oh, shame. I love cake.
Now at Staples, 500 business cards are just $9.99 every day. Copy and print more for less. At Staples, make more happen.
In-store and online and not combined. One site only on White Mat. No cash or credit back on prior purchases. Tax and shipping extra.
Call Quicken Loans now at 800-QUICKEN to see if you qualify for the government's Home Affordable Refinance Program, or HARP. And for 5 years in a row now, J.D. Power has ranked Quicken Loans highest in the nation in customer satisfaction. And for the second year in a row, they've also ranked us highest in mortgage servicing. Call 800-QUICKEN or visit QuickenLoans.com.
Visit jdpower.com for award information. Call for cost information and conditions. Equal housing lender. Licensed in all 50 states. NMLSConsumerAccess.org. Number 3030.
Talk Radio. Talk Radio.
790 KABC. Want to hear from the leaders and brilliant minds that work to keep you healthy and strong? The Doctors Roundtable is in session now on Talk Radio 790 KABC.
And we are back. You're listening to the Doctors Roundtable with Alan Gurvy, and we are here on Talk Radio 790 KBC, and we're talking with Dr. Farhad Sigari and Dr. Liana Georgoulis. Dr. Georgoulis, of course, we've had her on the show so many times, and she has so many important things to say from a psychological perspective. She is the founder of the Coast Psychological Services. Coast Psychological Services can be found at the website. What is your website, Dr. Liana?
You can go to coastpsychologicalservices.com or Dr. Liana, DoctorLiana.com.
You know, it's so funny because I always call you Dr. Liana, but for me, because I'm Canadian, it should be Dr. Liana. That's how we speak in Canada. It's drama, not drama, and it's the opposite. So I should have gone with the Greek pronunciation, which is Dr. Liana, which is Canadian, versus the American Dr. Liana.
Well, it's a little combination of both. If we want to get really specific in Greek, it's Liana, but in English, it's Liana.
Liana.
So I tend to kind of find a middle ground.
Well, I'm going to go with what makes you happy.
Well, thank you.
Which I hope can be, without my Greek accent, the American version. Now, Dr. Sigari, before the break, we talked about taking care of yourself when you have congestion, you have headaches, sinus problems. You said wait 7 to 10 days. Perhaps you may need some antibiotics. What happens after the time period lapses and you're not doing any better? When do you come to see you?
Right. So that's a great point. Is 7 to 10 days? What happens next? What does the patient do? Well, first of all, they can be seen by their primary care doctor. If it's their first time, they can be evaluated, and likely that time, if their symptoms are significant, he can verify that that's what's going on. They'll prescribe some kind of regimen, usually involving an antibiotic, and then also even some other medications that are even over the counter that will make them feel better, which they can start in the beginning actually. Something that will loosen up the mucus. That's what Mucinex is all about. You hear that, those commercials on TV. And
right.
Maybe a decongestant, and that's where something like Sudafed can come into play. Now, both these you can take before you get to the point with antibiotics, but they work really well after you started them as well. So the
and when does Dr. Sigari come into play?
Right. So when I come into play is when the patient has had this over and over again, 4 to 6 times a year, or if they've had it for more than 3 months, or if they get recurrent symptoms that just happen over and over again. For instance, the sinus pressure and the headaches that can even lead to fatigue that are really causing the patient to feel run down.
And I might add, I know a lot of patients who have these problems can't sleep at night. It's one of the worst things, trying to sleep. And then when you put that into the formula that you're not sleeping, you're feeling run down, before you know it, you're not functioning.
Exactly. And it's really interesting. Sometimes patients don't even realize they're in that situation. They've slowly gotten used to these symptoms. They're building over time. They get into this rut. They just don't feel right, but they don't know what the reason is.
Right.
Often somebody else's suggestion will bring him to the office. Either it's a partner or a wife or husband or significant other who notices that they're not breathing well, or they're snoring, or they're always sniffling, or they have headaches, and they don't really as themselves, but at another person or a coworker might suggest, look, you really should get in to see somebody. They have some patients that are actually very very self-in tune, and they're on the internet a lot, and they read about things, and they come predetermined or they have some kind of idea.
They have ideas, and
that's where she might come in and give us some.
But not only Dr. Liana, Liana, you have to talk about any doctor, because now with everyone searching the internet, looking up what may be wrong with them, they come to the doctors and they say, this is going on, this is happening. How do you deal with it? From a psychological perspective, you want to be able to do your own evaluation, your own examination, and not have these people self-report and tell you what they found on the internet.
Right. Well, I think it's all about balance. And back to what you were saying a moment ago, Dr. Sigari, and what you were saying, Alan, when people start to pick up on the fact that they're not functioning at their best and they may not be sleeping well and that their headaches are interfering with their occupational functioning or their ability to get things done, it starts to create a lot of anxiety. And then the more anxious people get, the worse some of these physical symptoms get, right? The worse the headaches can be. There can be dizziness. There can be more fatigue. And then, of course, the immune system starts to get affected by stress responses. And so people start to get really anxious. And that's where some of these, what we call in the psychological world, checking behaviors start to come in. So people get really anxious. They want these solutions. They go online and they start researching and reading. My sense of that, if somebody comes into my office and they have a sense of what might be going on and have done some research on reputable sites, that sometimes can actually be helpful. I've had people come in and say, do you think this is going on? And sometimes we can do things with that and it's helpful, but there's a certain point at which that becomes compulsive and a point at which that does not become helpful. And it can create so much more anxiety and stress and misinformation And what I see typically most problematic are these kind of health forums where a bunch of different people are talking about their physical problems. And these tend to be people who are most catastrophic in their thinking, talking about worst case scenarios and, oh my gosh, this happened and I took this medication and this happened. And then people just get really, really overwhelmed. So there's a point at which it becomes harmful.
Dr. Sigari, and of course we're talking to Dr. Farhad Sigari. He's with Delray Sinus, delraysinus.com. You can find him on the internet or contact his office at 310-773-0345. What Dr. Leanna is talking about makes a lot of sense. Now, from your perspective, because you deal with a lot of people who probably don't know what's going on. You know, when you've been called the headache doctor, Los Angeles headache doctor, people don't know what's causing it. So when they come to you, what is the first thing you do to try and determine, whether there's a sinus infection, there could be something more complicated going on in the head, that it's affecting breathing or affecting allergic type symptoms? What do you do?
Well, the first thing I do is actually just listen to what the patient's saying, not only what they're saying, but how they're saying it, and see how they're bothered by it. I mean, I think one of the biggest things that we can improve upon is listening to our patients. I think once I've had a good idea of what their story is, I ask a ton of questions. I mean, it is a litany of questions that I ask them, and sometimes I have to apologize because they can go to anybody and get antibiotics. They can go to anybody who can recommend a CT scan or allergy test, but we really want to get to the root of the problem before recommending the next step, because these patients are often frustrated because they have sought help somewhere else and they've told their story, but they've either not been happy with the results they received or were put in a different direction.
Now, let me ask you, because you talk about asking a lot of questions, and that, of course, is a real important thing. But isn't it true that you have to really do some diagnostic testing? People can say whatever they want to say, but until you actually do some testing, you don't know exactly what's going on.
That's exactly right. And that's why in our office we built a comprehensive program where if we needed to get a CT scan, they can get it right there in the office within 10 seconds. It's a low radiation scan that really will put...
Within 10 seconds?
10 seconds. I can get a full CT scan of the sinus.
It's amazing.
It's a lot less radiation than a regular CT scan. It's relatively inexpensive.
So what do? They just go into a room that you have beside your examining room, close the door, press a button, and then it's immediately available. The results are immediately
available. It's a room, it's the same size of a regular exam room. It's not even a special room. It's just a very specialized in-office CT scan. And the images are made available immediately, and I read the images with the patient. So I can easily show the patient. That's one of the things that's helped, is to relieve the patient of their fears, is that let me show you why you're having the problem, or more importantly, let me show you why you're really not having a problem.
Right.
Sometimes a negative scan is actually more informative than a scan that shows findings, especially in those patients that are anxious or over reading into their symptoms.
How extensive can you see the findings? I mean, can you detect tumors, for instance, or is that way beyond what this immediate CT scan can do?
You're asking all the right questions. So
I try to. That's what I'm here for.
The CT scan that we get in the office is actually dedicated sinus CT scan. So for sinus anatomy, it is excellent. It does not look into the anatomy of the brain. So if there was something going on in the brain, it's not set up for that. It's a lot less radiation. We can't read the pathology in the brain. So we don't even make any comments about if there is something in the brain or not that would be concerning. But we have picked up some things at the skull base because of the CT scan, and been able to talk about it, and which we will recommend a more investigative scan later in a regular traditional manner. But for sinus pathology, it is very precise.
So in other words, if there is a serious problem that you think may be occurring, you would refer that patient out for a full brain CT scan.
Right, if I was worried about the brain. But for the sinuses, I actually don't need another scan for that. But that's how exact this in-office CT scan is. It's very precise for the sinus.
That's really something. So again, follow up on this after you've done your litany of questions and you've done the sinus CT scan. How do you draw your conclusions, and do you do it immediately right there in your office?
Right. So since I've gone through the steps of getting to know the patient, ask them the questions, see what state they're in, and then I have the information between the physical exam and the CT scan, then I can try to correlate the two. Just because there's something that shows up on a CT scan does not mean that you have to do something about it. The patient might not be in a position or want to do something about it. They just want to maybe just know. So I have to, in my mind, put on my psychology hat a little bit and correlate the findings of the scan, explain them to the patient, and then give them the option that would best fit for them.
That makes a lot of sense. And Dr. Liana, you don't have the ease that Dr. Sigari has because you don't have the objective testing that an ENT physician would have. What kind of hints can you give us as to what you would look at in your diagnoses in these kind of situations where there's a lot of unknowns?
Well, it depends, specifically what we're talking about. And this is where psychology and psychiatry are not exact sciences. And sometimes sort of this concrete evidence is really helpful for people. We don't have that. But we have other diagnostic tools that we use, different tests, different measures that have been empirically validated and tested out over time. And that's kind of our toolkit. So that's what helps kind of inform psychologists, psychiatrists, and we make our clinical and diagnostic impressions based on that. But in relationship to health anxiety, because it's common that people who have health anxiety go to a lot of doctors and try to find out what's wrong with them, and oftentimes it's just their anxiety. So we have to be able to pick up on that as well.
Absolutely. Now, we have to take a quick break, but when we come back, we're going to get into some of the treatment and some of the things that can help you when you're suffering from these disorders. You're listening to the Doctors Roundtable with Alan Gurvy right here on Talk Radio 790 KBC.
I'm terrible with money. Apparently, a PhD in physics won't help me predict the trajectory of my own retirement. So I work with TIAA-CREF. You get quality, personalized advice no matter what your balance is. For me, they make investing as easy as Newtonian physics.
Advice for everyone. One more way TIAA-CREF is created to serve and built to perform. Visit TIAA.org. TIAA-CREF, Individual and Institutional Services, LLC. This testimonial is an actor portrayal. Advice is subject to institutional plan rules. Investing involves risk. Individual results will vary.
Call Quicken Loans now at 800-QUICKEN to see if you qualify for the government's Home Affordable Refinance Program, or HARP. And for 5 years in a row now, J.D. Power has ranked Quicken Loans highest in the nation in customer satisfaction. And for the second year in a row, they've also ranked us highest in mortgage servicing. Call 800-QUICKEN or visit QuickenLoans.com.
Visit jdpower.com for award information. Call for cost information and conditions. Equal housing lender. Licensed in all 50 states. NMLSConsumerAccess.org. Number 3030.
She went to Washington in 2011 as a freshman legislator. Now she's back to report on her experiences. She is Congresswoman Janice Hahn. Tom Girardi and Howard Miller's guest on this week's Champions of Justice. What does Washington try to do to newly elected officials? And is it possible to get Republicans and Democrats to agree on anything? Something? Tune in Champions of Justice this Saturday afternoon at 2 here on Talk Radio 790 KABC.
Traffic first on the fours and breaking news first. Only here. KABC.
You don't just get one physician and one option on the Doctors Roundtable. You can hear a debate where the health professionals discuss topics that concern you and your health.
Welcome back. We're here on the Doctors Roundtable. I'm Alan Gurvy, and I'm talking with Dr. Farhad Sigari, who has often been called the doctor for headaches in Los Angeles. He's the Patient Choice Award winner. He's with Delray Sinus and Allergy Institute, which is delraysinus.com. He is one of the top ENT doctors in the city and probably in the country. Joining Dr. Sigari is Dr. Liana Georgoulis, who is the founder of the Coast Psychological Services. Coast Psychological Services is at coastpsychologicalservices.com. She deals with just about everything you can think of that involves psychology, stress, anxiety, depression, self-esteem issues, and she is particularly astute at dealing with people who have physical problems that are are relating to psychological symptoms as well. So before the break, we were talking about the diagnosis of allergy symptoms, of sinus problems, of headaches. And I just got a text message from someone who was listening, and they wanted to know about nose drops and nose sprays and whether there is any danger to taking these sprays, because I guess they've heard in the media a lot of times saying that sometimes they do more harm than good. Dr. Sigari?
Oh, that's another good point to bring up. Actually, you're right. Up to recently, I would tell patients that any nasal spray that you see in the pharmacy that's over the counter, don't do it more than 3 days, because your nose can be physically addicted to those sprays. Normally, the names of those are Afrin, neosynephrine. These are nasal decongestants that work well for the couple of days that you use them, but after several days, often patients get addicted to them. And I see a lot of patients that have come from all over who've been on these sprays for years and always have to keep them in their pocket and use them 3 times a day. Those sprays are not good to use in the long term. But recently, there's 2 sprays. One is Flonase, and one is Nasonex. Both of these became over-the-counter. And these are nasal steroid sprays, and these are safe in the long term. You can actually use them on a daily basis for weeks or months at a time without significant concern for being addicted to it.
Well, that's very interesting, because you mentioned addiction, and as we know, Dr. Liana, for those of you who've been listening to the Doctors Roundtable right here on Talk Radio 790 KBC, you know Dr. Liana is also an addiction expert. And I want to know, Dr. Liana, we've talked about addiction with you in the past on other shows. Have you ever dealt with patients or situations where people, like Dr. Sigari is suggesting, have developed addictions to what we would think are very simple means of dealing with, congestion or colds or headaches?
Yes, absolutely. I talked about safety behaviors, and anybody can develop these compulsive behaviors, especially in response to anxiety about their health. It usually happens when people really attribute catastrophic consequences to some of these physical symptoms. So if they think that, their nose being congested is going to interfere with their sleep, and they're not going to be able to sleep, and they're not going to perform well at work the next day, then it creates so much anxiety, and then these compulsive behaviors start. So it can be with nasal sprays, it can be with sleep medication, it can be with all sorts of things. And
I can really identify with this, because I don't know about you guys, but I've had situations where I haven't been able to sleep, and I'm getting so frustrated. And I have used Flonase, and I will go and I'll just start scoring the Flonase, and I feel like it's not working. I just do some more.
Yeah.
I keep doing more, and I'm just like, it's my hyperactive personality that makes me a great trial lawyer, but it also makes me over-medicate myself.
Obsessive and compulsive. It happens to me, too. I have to say, I've used Afrin before, and I'm like, okay, this is great. I'm going to sleep tonight, right? So this anxiety starts to come up, and it's learning how to work with those anxious thoughts, right? So it's about saying, okay, if I don't sleep very well for the next night or two, it's not going to be the end of the world. I'm still going to function. I'm not going to lose my job over this, and within a couple of days, I'll get back into my normal sleep pattern. So we want to decatastrophize people's thoughts about health and sleep and functioning and all of these things.
That's some really great advice.
Yeah, I want to add in that if any patient finds himself needing a medicine, even if it's an over-the-counter medicine, and they're relying on it more than a couple of weeks in a row, or if they're taking the Prilosec for 3 months straight and they're still needing to take more, I think all those patients should really take the time to go be seen by their physician or specialist, because sometimes too much of even a little thing can be not good, or can mask another symptom.
It's an excellent point. Excellent point. For those of you who are listening, take heart on that, because I know a lot of us succumb to, just wanting to do anything to try and relieve symptoms.
Right.
And, sometimes when we don't know what's really at the core of the problem, we will try anything. When we talk about headaches, Dr. Sigari, how do you differentiate from a sinus-type headache, for instance, from a migraine or any other type of headache? Because people complain and they don't know what to do. Should they be taking Imitrex, for instance, for a migraine when it's actually a sinus headache?
Right, exactly. And the way to do that actually is to really go through the pathway of asking the right questions. Does your headache get worse when you're cold? Does it get better in response to Sudafed? Do you notice that when you're congested, your headaches are worse. Where are the headaches? Are they around your eyes or in the back of the head? Because usually if it's in the back of the head or neck, it's probably not sinus related. It might be something either your cervical spine or actually intracranial headache. Is it associated with anything such as auras? Can you tell they're about to happen? Do you feel like your pressure headache, or does it feel like your head's going to explode? So these are all questions when patients come with headaches that the physician really needs to get the understanding of, so they can better understand which pathway to go down. Is this more of a sinus issue? Is it more a neurological headache? Or is it some other type of issue that could be causing this? I've actually had patients come to my office who've had severe headaches, and it turned out to be something as simple as a deviated septum.
Really?
And something that
Can you fix that?
That is easily fixed. And in fact, we can fix this now often in the office. So there's a lot of procedures we can do that were reserved for having somebody do the procedure under general anesthesia that we've transitioned into the office. And that's important for patients to know, because some of the times they refrain from seeing a physician and continue taking these medications is because they're afraid of the intervention that's going to be worse than the relief they're going to feel. So they're afraid of the surgery. They're afraid of general anesthesia. Or even the cost is a insurmountable problem for them. So they stay away. But
when I look at you and I look and you're a young guy, you keep saying how things have changed. It really gives me confidence to hear what you're saying, because you're in the trenches. And, I hate to say it, but things have changed so much, especially in your field. Someone who's 75 or 80 years old, who's been an ENT his whole life or her whole life, doesn't seem to have the access and understanding of some of the newer techniques. When you talk about a deviated septum, for instance, because that wasn't around 40 years ago when they went to medical school, and you were on the cutting edge of all of these technologies that allow for addressing these problems in a much simpler and straightforward way than we used to.
Yeah, well, it might not be related to the age. There's some 70 or 80-year-old physicians.
I think I was in trouble for age discrimination there. But, hey, I'm a lawyer. I'll handle myself. Bring on the lawsuit.
There's plenty of physicians that are older than me that I look up to and that I respect, and they're on cutting edge as well. But I think it's important for the physicians in any field and anything you do, whether you're a lawyer or a physician, is to stay on top of what's current.
Right.
And more importantly, be willing to change what you learned. Dogma is actually a big problem. I think a lot of physicians are guilty of doing the same thing because that's the way we were taught. And I think as technology changes so fast, the physicians have to be very, very, very aware of what the new technology is, and more importantly, willing to change or be at least to try if it's deemed safe and effective. And these techniques that we're talking about are very safe and effective, and have been shown to be in medical papers that are studies for years and years. The response is very good.
And that's an important point, because we talk about the medical literature. What I do, we have the AMA guides, we have the M2s, which is the medical treatment utilization schedule. We have all kinds of guidelines for medical determinations, for impairment. But the key word that Dr. Sigari just said was dogma. Dr. Liana, you have to deal with this all the time when you're dealing with either other physicians, psychiatrists, or physical doctors, when they seem to be looking through a tunnel and can't open up your mind. Because I know the way that you approach things, it's more of a holistic approach, and you don't seem to have that dogma. How do you deal with other physicians, patients who are so dogmatic in their perspectives?
Right. I call it rigidity. But we all develop a framework and a lens. And you have one, I have one here. So I have to be mindful of my own lens and framework with which I see things, and kind of be aware of that. And it's about just staying current and reading the research and being willing to take in new information and being willing to shift these things around. But yeah, people have fixed ideas, rigid belief systems, and that's challenging. It's about how do you get people to be more flexible to new ideas and in their thinking.
It makes a lot of sense, and I got to say that we have to have some sort of flexibility in all branches of medicine, whether it's psychology or in ear, nose, and throat, any other specialty. You're listening to the Doctors Roundtable. I'm Alan Gurvy. We're going to be back for our last segment. In our last segment, hopefully we can talk about some of the positive things that you can do for your health with Dr. Liana Georgoulis and Dr. Farhad Sigari. They are some of the top doctors in their field, and we will hear more from them after this break.
People don't give a damn about anything or anybody when they're interacting on social media. They're so empathically divorced that part of that now includes encouraging murderers.
Yeah.
This guy was leaking what he intended to do on social media. It's called leakage. And people were encouraging him and telling him not to be a wimp and get out there and do this, and here's how you should do it. Really? That's okay, everybody. That's what we want. That's social media. That's civil discourse.
Dr. Drew, Midday Live with Psycho Mike Catherwood.
Weekdays noon to 3 on KABC.
Just in time for cooler weather, the Home Depot has 10 to 15% off select special order windows and doors from top brands like Andersen and Jeld-Wen. So let's turn drafty windows and doors into cozy days and nights. With savings like these, you're going to feel warm all over. Let's do this. Get 10 to 15% off select special order windows and doors from brands like Andersen and Jeld-Wen. Now, only at the Home Depot. More saving, more doing. Valid through October 14th. Exclusions apply.
If you're a 50-year-old male with type 2 diabetes, $500,000 of term life insurance is about $100 a month. Everyone needs affordable term insurance regardless of health. Call Term Provider and speak with Big Lou. Big Lou will find a term life policy for you even if you have type 2 diabetes, overweight, or have high blood pressure. For affordable term life for you, call Big Lou at 800-480-4694. 800-480-4694.
Home of the smartest listeners in Southern California.
I am the smartest man alive!
Talk Radio 790 KABC.
Alan Gurvy knows you want to hear about hot topics relating to your health, treatments, and alternative options. Interested? Stay with the Doctors Roundtable right here on Talk Radio 790 KABC.
Welcome back to the Doctors Roundtable with Alan Gurvy. I am your host, Alan Gurvy of the law firm of Rowan, Gurvy & Wynn. I'm a JD, a Juris Doctor. I'm with some real doctors here, Dr. Liana Georgoulis of Coast Psychological Services. You can find her at coastpsychologicalservices.com or drliana.com. I also have with us Dr. Farhad Sigari, who is one of the leading ear, nose, and throat doctors in the country. He's at delraysinus.com, delraysinus.com. You can call him at 310-773-0345. I want to get a little personal now, doctors. I sometimes snore. I hate to say it. My wife has been a little bit upset with me, and I don't know where it came from. I don't have sleep apnea or anything like that. I don't know if it's from congestion, but I have really, according to her, avoided addressing the problem. She bothers me and says, come on, I can't sleep and everything. And I just say, okay, well, I'll sleep in the other room. But what do people do? And she's actually asking, she's channeling me right now and asking this question. What do you do with this avoidance when you're fearful to actually go to the doctor or address a problem such as snoring?
Alan, I hope for the sake of your marriage you address your snoring problem. You would be surprised how much I hear about this in couples therapy sessions.
Really?
One person snores.
I thought I was the only one.
You are not the only one. And then the other person's a light sleeper, and it creates conflict, and then people have to sleep in different bedrooms, and then it affects people's intimacy and sex life, and it can become a big issue. So I hope you'll get that snoring in check there. But no, you.
I need therapy here,
right,
Leanna. Forget about that.
All joking aside, I think you raise a good point. What's a healthy kind of medical routine and repertoire? When does it become excessive and compulsive? And when are people avoidant and fearful? And that happens a lot too. So people deal with health-related anxiety in different ways. Some people get compulsive and check, and other people avoid seeing doctors and addressing health-related problems, and that can be really, really dangerous. I've seen a lot of and worked with a lot of people who go on to have much more significant medical conditions because they've been avoiding getting to their doctors and taking care of their health. So I think it's really important to find that balance and to really take care of your health on a regular basis. I think addressing things from a holistic perspective, having a balanced lifestyle is always a starting point, and doing what your doctors recommend, but also not going overboard and becoming kind of excessive in your fear or your checking. If you have reasonable evidence to believe you're healthy, go with that, but it is important to stay on top of your health.
If you want to hear more from Dr. Lana, go to drlana.com. And I'm listening to you very carefully, Dr. Lana, and now I'm talking to, I just want you to move aside for a minute because I want to talk to Dr. Sigari about this. I said that I was snoring. I haven't addressed it. I'm taking Dr. Leanna's advice. I'm addressing it with a doctor. What's up with me?
Great. So I think the concern a lot of people have is the intervention to fix the snoring is going to be a lot worse than the benefit.
Absolutely.
So they kind of stay away, or they haven't seen something that works, or they've been frustrated with what they've done in the past, or they've been recommended a major surgery that is scary or costly. So I think one of the ways that I can help patients with their avoidance issues is to make sure they understand that there are some simple and often quick techniques that we can do in the office now that can relieve them of significant symptoms. So we were talking about sinus disease earlier. One of the procedures that we do, which was previously reserved for the operating room, is a balloon sinus dilation of the sinuses.
That's a BSP. I know I was looking this up earlier, and I had never heard of BSP. So tell us about BSP. It's an easier way to say balloon sinuplasty.
Exactly. So your sinuses are air-filled cavities in your skull, and they drain through very tiny pathways. And when these pathways are blocked or narrowed from chronic infection, or blocked from worsening allergies, or blocked from bony anatomy that has been there since you were as congenitally and has slowly gotten worse, or shifted, or there was a fracture. When these sinus passages are blocked, the patient develops symptoms. They get worsening symptoms anytime there's any inflammation. They get the pressure, the pain. It can lead to fatigue. It can lead to worsening infection. So previously, they would have to have surgery and remove this bone that is the opening to the sinus. Well, with this technique, we're able to actually just find the natural opening through with a device that's very tiny and has a balloon attached to it. And once we're in the right place, we inflate the balloon and then simply remove it. And we do this in the different sinuses. And believe it or not, this is enough to take care of the majority of patients.
Really?
Yes. And it can now, before, for the ones who do a lot of this, were initially started doing this in the operating room as an adjunct or to traditional sinus surgery. Those of us who do this a lot found a way to transition this into the office. And with the right anesthesia protocol, which is only local anesthetic, we can do this with the patient awake, talking, and often laughing and joking with them. We inflate their sinus opening and give them the relief right there in the office.
Is it essentially pain-free?
So it's not totally pain-free. I would say some patients feel some pressure, but if you were to ask my patients on a scale of 1 to 10, what's the level of pain, it's usually 1 or 2. The key is to get them comfortable with the local anesthetic, and once they're locally anesthetized, they really don't have much pain or pressure.
So what about from an insurance perspective? Is this a procedure that you are getting authorization for all of the time, or is there something that you have to identify in the request for authorization showing a pathology that it would be required?
Well, definitely with every procedure that you do, you have to show that it's required. But as far as getting authorizations to your insurance companies, there are major carriers that approve it, and Medicare covers it, so it is well accepted. In California, there's a couple insurance carriers that have not come on board yet, and we're working on that to help them. Hopefully they'll change their mind, because it actually saves them a lot of money. It prevents us having to go to an expensive hospital, one that might be charging a lot more than the next one, or going through the anesthesiologist and all the issues and an extra visit to get cleared for the surgery, where we can just see us, do a local anesthetic, have the procedure, and go home and not have to worry about all the other additional costs that go with the surgery that's done at a surgery center or a hospital.
And it's interesting that you say that, because we deal with it all the time. The costs associated with not authorizing what is a fairly straightforward, simple procedure that will address the problems, and I'm sure Dr. Lana sees this as well in terms of her diagnoses, where they force people to be on, for instance, medications that are very costly for a long period of time, causing addiction, versus just doing a simple procedure that may eliminate the symptoms altogether and without a need for any further medical intervention. Dr. Liana?
No, I'm in full agreement, right? It gets back to we don't have a system set in place where we're looking at prevention and looking at holistic ways of treating people and paying attention to the mind, to the body, and all these other factors. And it's so easy to get into these quick fixes that over the long run are just strategies that don't do a whole lot.
Right. Well, and the benefit of this doing in-office procedures is the costs come down low enough that actually a lot of patients elect to pay cash. I had a patient that just flew in from Hawaii because she couldn't find anybody who would do this procedure in Hawaii, and she desperately needed intervention. She had actually polyps that were almost coming out of her nose, and she couldn't go to sleep to do this under general anesthesia because she was worried about her lungs. They were chronically inflamed, and they were worried that she would have a problem with that. She flew from Hawaii to her office. We saw her. We did the procedure the same day. The next day, she told us that she hasn't breathed that well since she was 16.
It's amazing.
Wow. And the whole time she's on antibiotics, steroids, just miserable, out of breath. And we communicated with us recently that she's super happy. And because it wasn't a $30,000 procedure, she was able to do it in the office. And
you said it wasn't. I don't want people to misconstrue that.
No, it was more than a third of the price. And often there's, depending on what needs to be done, it could be less. But she did great.
That's
she did
amazing.
Wonderful and had no risk.
I just want to tell the folks out there who are listening, if you do want to breathe easier, and we all want to breathe easier, go to delraysinus.com. That's DelRaySinus.com, or look up Dr. Farhad Sigari. He can be reached at 310-773-0345, one of the leading ENT doctors in the country, and he has the latest techniques to make you breathe easier, to understand sinus infections, to understand allergies. I want to thank you, Dr. Sigari, for being with us today on the Doctors Roundtable.
Thank you for having me. It's been a pleasure.
And Dr. Liana, as usual, you bring so much common sense. For those folks who are stuck on addicted to medications, call Dr. Liana. She will show you how to get off the medications, how to deal with your medical problems in the most efficient and effective way, and cause you to be a happier person. Dr. Liana can be reached at thecoastpsychologicalservices.com, 310-801-1711. That's 310-801-1711, or drliana.com. Dr. Liana, thanks for being on the Doctors Roundtable.
Thank you for having me. Always a pleasure.
Well, we've had a very, very interesting show today. I want to thank everyone for listening. I'm Alan Gurvy, and we will see you next time on the Doctors Roundtable with Alan Gurvy.
The preceding program was a paid commercial announcement. The sponsor is responsible for its content, which Talk Radio 790 KABC does not necessarily endorse or support.
Talk radio. Talk radio. Talk radio.
790 KABC. The Kings are back.
Back comes Gabrick, left wing to the circle, a shot. He scores!
They'll stop at nothing to reclaim their throne.
King to Carter, who scores? Toffoli to the net, shoots, scores! Moving in Kopitar, scores!
Don't miss a second of the action as the Kings go for their third cup in 5 years. Kings, Canucks, Tuesday at 7 on your home for Kings Hockey. Talk Radio 790 KABC. Every 40 seconds, 136 million emails are sent. Over 1.6 million Facebook posts are posted. And one person will die of heart disease or stroke. But you can make a difference.
Join 790 KABC and the American Heart Association at a heart walk near you. Help raise awareness and funds to build healthier lives in our community by forming a team with family, friends, or coworkers. The fight against heart disease and stroke starts with you. To form a team and find a heart walk near you, log on to kabc.com/events. Sponsored by Union Bank, USC Verdugo Hills Hospital, and Menchie's.
I'm more resourceful than I thought.
My suit can still make an impression.
My video games are still game changers.
And my lamp can bring others a bright future.
Because when I donate my stuff to Goodwill,
it helps fund job placement and training for people right in my community.
Now my stuff gets a second chance.
And will give someone in my community
a second chance too.
Goodwill. Donate stuff, create jobs. Find your nearest donation center at goodwill.org. That's goodwill.org. This message brought to you by Goodwill and the Ad Council.
All month long, KABC celebrates Talk October. Our month-long salute to